This presentation is about reference-based pricing, the new way to reduce cost and increase access using a powerful new remedy to cure the high cost of health care. Let's keep this simple. What do we want? We want a different, affordable way that working people can pay for health care. Why do we want it? Because today's health insurance is far too expensive and it's going up. It's not working. What am I trying to sell here? Absolutely nothing, just an idea, not a product, not a service. So what is this new idea and how does it compare to today's health insurance? There are two types of health plans on the market today. The traditional managed care plans and all sorts of different models of those, and the new reference-based price plans that are coming on the market at this time. Under the traditional managed care plans that you're familiar with, someone else manages our healthcare decisions. We spend more money on health insurance, so we have less money to spend on other things. We live with the limited choices that are negotiated by the insurance companies. Our doctors must satisfy the managers, and the managers define and measure quality. It's all okay. It's your choice if you're happy with that. Under the new reference-based price plans, it allows us to be more independent with our own healthcare decisions. We have more money to spend on something other than health insurance, and we have multiple provider options from which to choose. Our doctors must satisfy us. We directly measure the provider's quality, and it's all okay. That's our choice. This is expensive and nearly unaffordable. This is less expensive and more affordable. Let's find out more. How traditional insurance works is this. You pay a monthly premium or someone pays it for you. You have deductibles, co-payments, and co-insurance. When you see a provider, you choose from someone in your network. You pay whatever is due at the time of service, like a copay or co-insurance, but you have no idea what it costs. The provider sends you a survey afterwards, and that's your chance to grade the provider. And several weeks later, you get an explanation of benefits form, and usually can't decipher it. The next renewal, your insurance premium goes up. You may have a high deductible plan and have to spend a lot before your insurance begins to pay anything. You might be motivated to ask the price of care, but you're limited in choosing providers based on how much they charge. Are there less costly providers in your network, or are your choices limited? Minnesota law now allows you to get the price of care if you ask, but you have no way of knowing what's a fair price. Providers have a billed price, but they also have negotiated prices, and many of them. Each network negotiates a price with the provider. Insurance companies use a common reference price to determine how much they pay providers. And the common reference price is the Medicare allowable amount. The Medicare allowable amount is the amount the government pays to a provider for a Medicare enrollee. Minnesota health plans on average pay providers 187% of the Medicare allowable amount. So if Medicare allows $100 for an exam, the average provider payment is $187. If Medicare allows $1,000 for an MRI, the average provider payment is $1,870. If Medicare allows $10,000 for a surgical procedure, the average provider payment is $18,700. See how that works? Reference-based priced insurance is different. Your health plan pays a provider a proportion over the Medicare allowable amount. You choose a plan based on the rate over Medicare you're willing to offer a provider. The provider is free to accept the amount or less or ask for more. You are free to agree with the provider's price, negotiate for a better price, or go to a different provider. Here are some examples. You choose a plan that pays, let's say, 125% over Medicare. or 150% over Medicare, or 200% over Medicare. Your premium is going to depend on the rate you choose. If you choose a plan that pays 200% over Medicare, it'll cost you more in premium. One that's 125% over Medicare will cost you less in premium. If you know the percent a provider charges in reference to the Medicare rate, you can compare the amount you'll pay to different providers. For example, let's say you want to get an office exam and you ask each clinic in your area, what percentage do you charge above Medicare? Clinic A charges 125% above Medicare. Clinic B charges 150% above Medicare, and Clinic C charges 200% of Medicare. So you can choose the doctor with the lower rate or the higher rate. The value to you of the doctor's work is shown by your willingness to pay his price. Let's say Pat and Jan are going to have a baby, so they ask each hospital, what percentage do you charge above Medicare? Hospital A says 140% above Medicare, and that's pretty common, by the way. Hospital B charges 300% above Medicare, and you say, oh, no way. No, it's true. Some hospitals do charge a lot more than Medicare. Hospital C charges 175% above Medicare, closer to our average here in Minnesota. So Jan and Pat ask the hospitals why they charge what they charge and what they're paying for and whether there are options. The value of the hospital's care is shown by Pat and Jan's willingness to pay their price. For example, you may have a reference-based insurance plan that pays 150% of Medicare. The doctor charges 250% over Medicare, or $435. Let's say Medicare allows $175 for whatever this is. And your plan at 150% of Medicare pays $265, which is Medicare plus 50%. So you're free to agree to the provider's price and pay the extra $170 if it's worth it, or go to some other doctor somewhere else. Or the provider can agree to take less to keep you as a patient. Here's another example. Your doctor prescribes an MRI of the liver and says, why don't you go to ABC Radiology? They do really good work. At ABC Radiology, they don't want to tell you their rate, but they do disclose their price because, well, the law says they have to. The price is $1,895. You find out that Medicare allows $385. Wow! They want almost 6 times as much. Yes, this does happen. So your reference-based health plan that you chose pays 200% over Medicare, or $770. If you don't want to pay anything out of your own pocket, you want to go to a provider that doesn't charge more than $770. But you have options. You can agree to pay the $1,225, or ABC Radiology can watch you walk out the door. And I'm talking about the difference between your health plan and what they want to charge you. Or ABC Radiology can accept $770 as payment in full, or you can agree to something else like $995 and you pay the extra $225. Or you go to DEF Radiology, which charges only $850 for the same MRI. It's your choice. Here's another example that comes from Minnesota, except we changed the names, obviously. Dr. New and Dr. Old are both OBGYN doctors, and they perform ovarian cyst removals. Dr. New's data shows that 98 out of 100 ovaries can be saved using the New Wave procedure, leaving 2 women out of 100 with only 1 ovary. Dr. Old's data shows that 60 out of 100 ovaries can be saved using the traditional way procedure, leaving 40 women out of 100 with only 1 ovary. Now here's the deal. Dr. New charges $1,000 more than Dr. Old to perform the surgery. You, given a choice, knowing the price up front and understanding why Dr. New charges more than Dr. Old, can make an informed decision. A woman who doesn't want more children might choose Dr. Old and thereby save money. $1,000. But a woman who wants more children might choose Dr. New, spending the extra money, knowing the chances are good that she can keep her ovaries and bear children. There are many benefits of a reference-based price insurance policy. First of all, reference-based plans allow you to choose any willing provider. There are no networks. Out-of-network care is eliminated because there are no networks. There's no surprise billing for out-of-network care because there are no networks. And it'll reduce the price of care over time, if not right at the beginning, because it's less costly to administer. There's fewer billing errors, and it creates open competition with other providers. So why would patients love this new plan? Well, affordable health insurance with rates reduced by as much as 50% of today's premium. Does that sound interesting? Receive medical care from whomever we choose, no network limitations, knowing the price of health care before receiving it. Instead of basing a decision on who's in our network, we base our decision on price and quality of care, choosing anybody that we wish that's willing to accept our rate. Better access with shorter wait times. It allows for a physician-patient relationship without third-party payers or administrators in between. There's much more awareness of the cost of care because you understand how provider charges relate to the premium that you're paying. It allows for price and quality shopping for your own preferred providers. You put providers on notice that they have to compete for business based on quality, price, and access. It'll improve the quality of care while reducing its cost. That sounds like a winner. Why would doctors like this? Well, first of all, they can practice ethics-based medicine, spending more time with their patients and less time checking off the boxes required by managed care managers. They're freed from top-down, micromanaged third parties. They're freed to have independent practices if they want it. They have control of their own work schedule. They can compete with other doctors to provide health care, differentiating themselves from other doctors. And it greatly reduces their billing and administrative costs. No more networks and no more multiple reimbursement schedules. Some doctors in some clinics have 40 or 50 different reimbursement schedules, several with the same insurance companies. This does away with that. Why would insurance companies love this? First of all, it reduces their administrative costs, but it also increases their ability to compete with new insurance companies entering the marketplace. And they can enter the marketplace without having to build networks with reluctant providers who really don't want to sign any more contracts. And it can allow those carriers to expand their market across state lines. Why? Because there are no networks. So reference-based pricing. I encourage you to ask your health insurance agent for more information. If they don't have answers, find another health insurance agent. Then ask, how can your employer or you benefit from this great new way to buy and use health insurance to give you access, quality, and a better price for the health care you need and deserve? Reference-based pricing is truly an idea whose time has come.